Today we are going to discuss the voice facilitating technique known as relaxation. We all encounter stress in our daily lives, and what is important is how we react to that stress. Patients with hyperfunctional voices often develop vocal symptoms as part of their stress reaction. Voice symptoms such as diplophonia, dry throat and mouth, harshness, elevated pitch, functional dysphonia, and shortness of breath have been found to be particularly related to stress. For these individuals, a goal of voice therapy will be to take the work out of phonation by using techniques such as relaxation to reduce the tension associated with speaking. Relaxation can help relax the components of the vocal tract and has the potential to affect the pitch, loudness, and quality parameters of voice. In addition, open mouth, yawn sigh, and hierarchy analysis approaches are often used alongside relaxation to help achieve a healthy voice. There are several different techniques you can use to implement a relaxation approach in voice therapy, and I am going to discuss some of these now. For your adult patients, it will be helpful to provide material on stress management and posture and release for them to read on their own and help implement these techniques in their daily life. The clinician can also introduce the concept of differential relaxation, in which you instruct the patient to concentrate on a particular site of their body and tell them to deliberately relax and tense certain muscles to help them discriminate between muscle contraction and relaxation. So you can have them start with their fingers and toes and move up to the torso and chest and neck and facial muscles and get to those muscles that are probably associated with their vocal issues. In addition, you can use biofeedback devices such as pulse rate or blood pressure to visually demonstrate to a patient their particular arousal state during relaxation and stressful situations. That way they can learn what it feels like to be relaxed and have that visual feedback to prove it to them. Head rotation techniques might be introduced for relaxing components of the vocal tract. You can have the patient drop their head forward to the chest, to the right shoulder, back, and to their left shoulder, and have them repeatedly do that until they feel relaxed. Once they do feel relaxed, you can ask them to phonate in ah and record it in order to compare it to their other phonations when they are stressed. Another technique you can use is open throat relaxation. You can have the patient lower their head slightly toward the chest and make an open, prolonged yawn, really concentrating on what the yawn feels like in the throat. Then you can have the patient prolong an ah, capturing and maintaining that same open throat sensation that they felt during that yawn. And lastly, you can also ask the patient to think of a setting he or she has experienced or imagined as very relaxing for them. With some practice, the patient can find that setting that works for them and recreate it in their mind to use in future tense situations to help them maintain a relaxed mood. So overall, as I said before, we all experience stressful situations in our daily lives. Symptomatic voice therapy focuses on the voice problem, and sometimes there is tension associated with the problem, or it may even be the cause of the vocal issue. Direct symptom modifications, such as teaching relaxed responses, can help break up those learned responses that often keep harmful vocal behaviors alive. Overall, relaxation techniques have become increasingly popular, and they do have the potential to decrease tension and the vocal symptoms associated with it. So thank you for watching, and have a great day.